Now, further moving towards orthodontic reasons when we actually extract the tooth. In orthodontic, actually, either due to the crowded dentition, the crowded dentition is basically because the arch length is insufficient. In that case, we actually require the extraction of teeth in order to provide the space or space for the upcoming teeth or either for the tooth alignment. Even we actually extract the tooth for the braces also. The most commonly is actually maxillary and mandibular premolars. Sometimes occasionally mandibular incisors can also be taken if extraction is indeed necessary and the teeth are correct or removed if someone other than the surgeon during the extraction has been planned. Now, miss malposition teeth. Malposition teeth means either the teeth is actually buccally tilted or either lingually. In that case, actually they actually traumatize the soft tissues and they cannot even be repositioned or corrected by orthodontic treatment. In some cases, for example, like maxillary third molar, when it erupts buccally, so it can cause ulceration of the cheeks. The tooth that are supra-erupted or hyper-erupted due to the opposing teeth missing, it can also give interference in the prosthesis when it is making. When adequate prostheses are construction in, so in this condition the malposition teeth has also been should be extracted. Cracked teeth is actually either uh, a crooked crown of a fractured root. This can be very painful and unmanageable by conservative techniques. So, even if already undergo endodontic treatment in the past, but it tends to make the crown more brittle and fragile and difficult to remove. Means the RCT was done in the past, but this was unsuccessful, and the patient does not get relief of the pain, but the crown and root become brittle and difficult to remove due to also endodontic treatment, so this too should be extracted. Okay. Impacted teeth. Basically, when it is partially erupted, teeth is unable to erupt into the functional occlusion because there is not adequate space, and it can also interfere the adjacent teeth. So, when the teeth, the impacted teeth needs to be extracted in these cases when you do not have space for their eruption in the arch. Now, moving towards the supernumerary teeth. Supernumerary teeth either interfere with the eruption of the succedaneous teeth, means secondary teeth, or has potential for the resorption and displacement of teeth. Okay, means it can interfere with the eruption pathway for the upcoming permanent teeth and cause the resorption of the uh, uh, permanent teeth also. Okay, now teeth with associated with pathologic degeneration. Okay, like you can see odontogenic cyst in this situation. Okay, the teeth that can be also retained, endodontic therapy has been performed but it is not successful. And first of all, teeth that are also associated with like cyst, teeth involved in such conditions may require removal. Okay, however, if maintaining the teeth compromises the complete removal of the lesion, means if you maintain the teeth but it also compromises the complete surgical removal of the lesion, when complete removal is critical, the teeth should be removed. Means it should be removed on time. Either you actually let the teeth to be present in that cyst or that lesion. Okay, now basically, but if the teeth is actually associated with some malignancy like squamous cell carcinoma, so it should not be removed in that case, because when you removed it, so it starts rapidly dividing and spread into the soft tissues and bone. So the lesions, the tooth that is present or that is actually related to some malignancy, it should not be extracted because it can change the stage from mild to severe stage of that lesion. Okay, so you should be careful. Okay, in this case, radiation therapy, in case of oral head cancer, it should removal of teeth. Okay, particularly if the teeth are compromised in some manner. So in radiation, actually, what we do before when patient is taking the radiation therapy, so before radiation, we check the tooth for any carious lesion. If it is carious, it is filled. But if the patient has actually irreversible pulpitis, means the RCT is actually done, means reversible pulpitis or irreversible. Okay, but if the tooth is compromised and it is so it should be then extracted before radiation, because the effects of radiation after is that the salivary flow become decreases, because the enduring radiation the salivary glands are affected and the saliva amount is reduced, so there's high chances of caries after the radiation. So in such cases the maintenance of oral hygiene becomes also difficult actually. Why? Because oral radiation actually causes also fibrosis. In fibrosis, what we have actually limited mouth openings, so a patient cannot maintain her oral hygiene. The second, it also produces mucositis. It actually ulcerate or damage the mucosa lining very rapidly. Okay, so when mechanism of damage of these cells uh, is like they damage the cells of DNA in case, but do not we will go in deep of that. Activation also of the free radicals in the lysozyme enzymes and damage the cells, so rapidly increasing the cells and that can be damaged. In such situation, brushing is very difficult, okay, for the patient. In such if the in such teeth are left, so it can cause infection can be developed it after this, and the blood supply to this area is compromised. So if you do actually extraction, so it is better. Okay, now there is also healing in that area, then it will uh, cause the osteoradionecrosis. The healing process in these patients become uh, difficult or delayed due to osteoradionecrosis happens to this. So this result in osteoradionecrosis. The healing process is going in that area. Okay. Now basically sometime what we will do in these patients, we give actually hyperbaric oxygen. Hyperbaric oxygen increase the levels of the increase the plasma levels of oxygen, and the patient is put in a chamber that is filled with oxygen for 90 minutes, due to which there will be the activity of fibroblast and they will form blood vessels that will provide nutrition to the bone, and the healing will be fast in this case. Okay,